Hi, my name is Dr. Sharon Borkowski, and I practice functional medicine here at Naperville Integrated Wellness. I would like to take a few minutes to share a little bit about myself, what I do, and why I do it. I think a good way to start is to talk about the spark that led me to pursuing functional medicine. Starting back when I began having health issues of my own, I found myself fascinated with the inner workings of the human body. Even before this, as a young child, I also realized that I had a passion for educating. I even fondly recall that I used to practice teaching from a chalkboard to my invisible audience. As I got older, these two interests and desires came together in my role now as a functional medicine practitioner. Now, why functional medicine? In part, due to my mother's chronic illness, I developed a desire to understand root cause medicine. That is, medicine that identifies and treats the underlying cause of illness. You see, my mother was unwell both physically and mentally. She had been taking no less than 6 different types of medications, none of which guided her to wellness. Unfortunately, she passed long before I discovered this type of medicine. But when I learned how different this medicine was from anything that I had been exposed to previously, I pursued it, and it led me to what it is that I do now. What is it that I do now? Simply, I educate and collaborate with my patients. While doing this, I help to remove barriers that undermine health. I support patients to incorporate healthy new behaviors and help with the help of blood testing and functional medicine testing. I provide guidance on nutrition, healthy eating, and detoxification, etc., to restore and then to maintain health. Now, those of us who practice functional medicine agree that the answer to a symptom is not necessarily a need for medication. Sometimes I find myself thinking, for example, that when I have a headache, I know that headache is not due to a deficiency in ibuprofen. Instead, I look to the root cause. In this case, or in most cases with me, I find that the reason for my headache is due to dehydration. So what I'm saying is that medication can be important in some cases, but looking for the underlying cause is actually the most important thing. So again, this is just an example of functional medicine, and that our job is to educate, for instance, on the importance of adequate water intake. Now, another aspect of my role is to provide needed support to assist in removing obstacles to health. Now, for example, this may be a need to remove harmful foods or beverages from the diet. Now, fast forward to health later on in life. Once it's restored, we need to maintain it. And as I continue to pursue knowledge on how important my own health is and the health of my patients, I have begun to talk more about quality of life. And although longevity is important and certainly desired, I have observed that although people are living longer lives, most people seem to be in much poor health later in life. Now, rather than accepting disease as a natural consequence of aging, I view what I do as a way to not only restore health, but to maintain it throughout life. So in summary, my passion for health and for guiding people to better health stems from my own health as well as that of my mother's. And it brings me great joy and pleasure to be able to provide a form of medicine that can truly help people to restore their health and allow them to maintain it for the rest of their lives.